Central Florida Healthcare was started in 1972 in Frostproof, Florida, and started by an agricultural company that identified the health needs for their employees. So we started in 1972 with one doctor and one nurse, and we have grown to 14 clinics since opening the one clinic in 1972.
Central Florida Healthcare steps in and steps up in a very unique way, being the only federally qualified healthcare network in the Tri-County area.
Central Florida Healthcare serves Polk, Highlands, and Hardee counties, and we have 14 clinics. 12 of those clinics are in Polk County. We have one clinic in Wauchula and one clinic in Avon Park.
Well, as a human being, one essential thing that we all need is healthcare. And unfortunately, sometimes life hits and we may not have the financial stability to always pay for those visits. And the great benefit about Central Florida Healthcare is that we serve everyone.
Community health centers are patient-focused. Since inception in the 1960s, community health centers have served the underserved regarding healthcare needs in the communities.
Community health centers are important because in addition to having payment plans, we also do have different options based on the sliding fee scale where we can provide services at a low cost.
Central Florida Healthcare is critical to the communities that we serve in because we offer healthcare to everybody. So we serve the uninsured, the underinsured, the Medicaid population, Medicare, and also treat people that have insurance.
We consider ourselves champions of health equity. To be honest, we serve a large demographic, right? So people from different backgrounds, and so people from different backgrounds are going to have different needs. And so in order to fulfill those needs for those patients, then we have to make sure that we diversify services we offer.
We want to address every need that our patient has. When they come into our clinics, we want to be able to take care of them because we realize that systemic health is connected to your mental health, is connected to your physical health. So we realize that it's really important that we be able to provide all the services our patients need in an environment that it's easy for them to access and to move from one discipline to the next.
We have services for the entire family. We have services for dental, for adults and pediatrics. We also have primary care, OBGYN, obstetric services as well. And we also have pediatrics. We have our in-house lab, x-ray. We have pharmacy services. We have optometry. And we also have behavioral health.
That one-stop shop is very important because many of our patients have barriers to care, one of them being transportation. We have patient-centered navigators, caseworkers that work with our patients so that we can set up appointments and try to meet the needs of the entire family, which also includes providing transportation.
It's super important that our patients can get all their needs done in one day so they don't have to take off work more. They're more willing to get everything done if they come in and they can have the x-ray done and their labs pulled and they can get their prescriptions filled before they leave.
At Central Florida Healthcare, we treat every patient with dignity and respect. We don't know what hardship people are going through or if they're going through hardships at all. So it's important to just treat everyone with respect and dignity.
One thing about our employees at different clinics, I've visited several different clinics, not only in observation but also as a patient. And it's just like when you walk through the door, you felt that genuine care. You felt that genuine willingness to assist you in whatever it was that you needed.
Central Florida Healthcare is important to the community because without their range of services in the locations that they're intentionally placed, many of our neighbors would go without healthcare.
The value that we add to keep people out of the emergency room and try to keep them healthier and focus on a healthier community is very valuable.
As we treat that individual, we make connections and we improve the health of that individual, that in turn impacts the family. And then, in turn, the family, it's an exponential effect, and the family gets to impact the whole community. So in starting with the one patient and improving the health outcomes of that one individual, we are causing a community effect.